I'm pleased to be joined today on HealthBeat by Dr. Jason Bailey, a podiatrist specializing in foot and ankle surgery with Faith Regional Physician Services Orthopedics in Norfolk. And we're talking about bunions. So how do you treat patients that have bunions and a hypermobile foot structure?
Well, Rob, thanks for having me today. Referencing what we had talked about in another section, we had talked about bunions and people that have them and how they form.
Yes.
Well, there's a special type of bunion that's caused by what we call a hypermobile joint. Okay. Now this foot model that I have here, we'll kind of reference this joint. So this is the first metatarsal bone right here, and this bone is one of the tarsal bones called the cuneiform. And at this joint here, especially we see it in women, more commonly than men, but we do see it in both, that there becomes a hypermobility or excess motion at this joint.
Oh.
As that joint becomes hypermobile, that allows the first metatarsal to start to deviate and spread out and lengthen the gap between the second metatarsal and the first. And at the same time, that causes the big toe to move over, which results in a bunion deformity and pain along the great toe joint.
Sure.
As we can see in the x-ray above us, that that first metatarsal is starting to move out away from that second metatarsal. They're no longer parallel.
Right.
Like they once were. Those two little round bones underneath the metatarsal head are similar to our kneecap. They're called sesamoid bones.
Oh.
And they are supposed to sit underneath that metatarsal head. And those bones don't move. So as we take x-rays like this and we see those bones further in between the other two bones, that means that metatarsal has been migrating over top of those, causing that bunion deformity.
Yeah.
So these are treated differently surgically than the Austin bunionectomies that we had talked about previously. As we can see up here, we do what's called a fusion or an arthrodesis of that hypermobile joint, the first tarsometatarsal joint. And we can see there plate and screws that are holding that joint together while that joint is healing. And essentially we're trying to make two bones one and remove that excess motion in the foot.
Okay. Well, very good. That's very interesting stuff.
Thank you.
Thank you. To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.